So one common question is, what do you have to do after Mohs surgery as far as restricting your activities? How do you get back to your normal level of activities after the surgery? Usually during the first week, your activities are pretty restricted. No lifting anything heavier than a gallon of milk, and no cardio exercise, nothing that gets your heart pumping or makes you break a sweat. So you can walk to limber up, but we usually recommend that you limit it to that, and definitely no lifting. During the first week is the highest risk period. After everything's healed in for a week, you can just ease back into normal everyday activities. I usually tell people that if you feel throbbing in the area of the surgery, you know you're doing too much too soon, so definitely back off on the activity. But especially for the face and neck, about a week is what's needed before you can safely go back to your full exercise routine, or lawn and gardening, or whatever you like to do. For the trunk and extremities, so anything off the head and neck, it's usually a 2-week period where you have to avoid exercise and avoid exertion. And that's just because there's more tension on those areas, and the bigger muscle groups could cause a lot more pulling and tugging. And there's a risk that sutures could break, or that you could have significant bleeding under there. So anywhere on the arms and legs or on the trunk, it's a little bit of a longer recovery period, usually 10 to 14 days. And we'll give you some specific counseling based on the location of your wound and how tight it is on how long you actually need to restrict activity.